As more Americans prepare for Obamacare sticker shock, and it's coming, the pharmaceutical company Mylan is reeling from more charges of crony capitalism. In response, Mylan is promising to make a generic version of its EpiPen drug. The EpiPen, made by Mylan, it is vital to saving the life of any person with a food allergy. My 4-year-old son, for example, deathly allergic to nuts. You have to travel with this EpiPen as a parent. And if you're, someone who's older who has one of these food allergies, again, you've got to travel with this thing. It's extremely important. But here's the rub. According to reports, Mylan spent $4 million lobbying Congress so that its products, the EpiPen, would be required by all public schools in the United States. And once Mylan got the deal with the schools, well, what do you know? The price of the thing goes up. Now $600 today. Used to be $57. Mylan, we should also point out, is a major donor to the Clinton Foundation, and Hillary Clinton, she never said boo about the company's apparent price gouging until the public fury reached the level we have now seen on this thing. So here is the question. How do we get all this crony capitalism out of the pharmaceutical industry? Joining me right now, CATO Insititute Senior Fellow Michael Tanner. Michael, good to see you again.
Pleasure to be with you.
What's the answer? I mean, how do you prevent this kind of lobbying effect from really causing some price gouging for these drugs?
Well, this sort of thing couldn't exist in an actual free market. For example, there are actually 2 competitors right now that are trying to bring EpiPens to the market, and they're mired in the red tape of the Food and Drug Administration, which hasn't approved their product yet. That guarantees a virtual monopoly for the current company. There are 3 different EpiPen makers in Europe, in addition to Mylan. So basically, we're being blocked out of any sort of competition, any sort of free market response in this country by the bureaucracy.
So this is sort of big government at work. I mean, do you blame the Obama administration for this?
Well, this is something that's gone on for a long time under multiple administrations. The fact is that the FDA is very slow to bring products to market, and therefore it keeps the competition. It's a barrier to entry.
Why is that, though? Why, I mean, is it in our interest for them to really vet this stuff, or, as you point out, look, in Europe, they have multiple competitors to this, which makes it a whole lot harder to charge $600 if your competitor's charging $50.
Well, to some extent, it's what's seen and what's not seen. If somebody gets sick and dies because of a bad product, that gets seen. You guys play it up in the media. It's going to be a big scandal. Nobody wants that, so the FDA is very cautious. But nobody sees the price gouging that goes on or the people that die because a new drug's not brought to market. That's sort of hidden away in the background, and we don't complain about that.
Well, now people are starting to a little bit more. But you mentioned this FDA. I mean, I think about sunscreens, for example. UVA and UVB is very important to have both kinds of protection. But for years, you could only buy one kind of protection in the United States because the FDA would only approve one. If you wanted to guard against all kinds of sun damage, you had to buy that stuff over in Europe.
Well, that's right. I know people who actually smuggled sunscreen back into this country in order to get the better protection that was available. The fact is that we are very slow, and it's very expensive. People talk about the high cost of drugs in this country. One of the reasons is it's a very lengthy and expensive process that companies have to go through to get approval, and they can go through for years, then be turned down, and that's just a sunk cost that they've had to bear.
Well, the less bureaucracy, I think we'd all agree, the better. Michael Tanner, good to see you. Thank you so much.